Hello, dear friends. My name is Dr. Ashok Rughani. I am a sexologist practicing in Ahmedabad. I am 65 years old. I would like to share my personal experience of COVID viral infection which I contacted in the month of July. So I'm going to share it with you. The reason for sharing is to inform friends and relatives and whoever needs advice that this is a serious viral infection. People should not take it lightly because it can lead to so many complications, and because it is a new virus there are so many complications which even doctors are not aware. So I am going to share my personal experience. I developed fever on 3rd July. So I came from the clinic and went to the bed, rested, and I was quarantined from 4th July just to be on safe side. Stayed in my room only and not having any contact with anybody in my house. For a couple of days I had a fever. I was taking paracetamol, but fever was persistent. So I discussed with my physician and checked the blood to check the parameters of the infection, and did the COVID-19 virus test, which is called RT-PCR test. They take the throat swab and nasal swab. The test was done on 6th July and it came positive on 6th July at night after 8 hours. So it was a shocking for me, because when you know that you have an infection, naturally it psychologically it affects you. But I was quite sure that I am going to fight it out. I discussed this with my Dr. Breach Telly and Dr. Rajesh Telly. Breach is working with Civil Hospital Rajkot as a physician specifically in COVID ward. So he has a lot of experience of the COVID viral infection. So after discussing with him, he advised me to just stay at home, have home quarantine for 2 weeks strictly, do not go out and take the medication. My doctor advised me to take the medicines. Along with the medicines, I took care of the home remedies of drinking hot water, taking a lot of juice, drinking soup. I wanted to make sure to drink at least 250 ml of liquid every hour to prevent dehydration. So to prevent dehydration, you need to keep on taking liquids. It's very important to avoid dehydration, because dehydration leads to so many complications in COVID-19 case. Second thing, I was doing steam inhalation at home, which is very simple to do it at home and everybody can do. So 3-4 times in a day I was using steam inhalation. The third thing which I was doing was checking my temperature every 4 hours and oxygen level of the pulse. Now to check the oxygen level of the pulse, there is a very small medical device. It's called pulse oximeter, which you just buy it. You can buy it from anybody in the shop, from the chemist shop, and you can use it very simply. Check the your oxygen level. It's very simple. Within few seconds you can get the level. Your goal is not to allow oxygen level less than 94. If you notice that your oxygen level has gone down to less than 94 percentile, then you need to inform your doctor. Probably you might need oxygen. You might have to go to the hospital for hospital care. So pulse oximeter is very user friendly. You can do it at home on regular basis. I was checking my oxygen level every 4 hours and was keeping a chart. Second thing, you need to take the medicine as per your doctor's advice regularly. I was checking my some blood also to make sure that the infection level is under control in the chest. Even we did the chest CT scan to check that there is no any sign of pneumonia. I had about 10% infection on 5th day, but it was manageable as per my doctor's advice, and so we did not bother much. The other thing is very important is the psychological trauma. This sickness leads to a lot of you feel sad, you get frustration, you feel depressed, and you can start thinking negative. And being a medical doctor, we always think more negative about the complications, and there are some complications can lead to real problem, and this usually pneumonia or some heart problem, pulmonary embolism or stroke. So that also is there, but we need to be careful, we need to be positive, we need to fight it out. Be positive, be your friends and relatives and family members and doctors can support you, so that your friends, relatives can also keep on talking with you on phone and video, so that you do not need to, you don't get so much frustration at home. The other important thing is that you need to be in social touch with your family members also. And the last but not the least, whatever God you believe, religiously or spirituality is very important part to prevent depression, and it gives you strength, inner strength to fight against infection. Whatever God or whatever religious you believe, you must pray to the God and you need to be positive. I was doing regularly yoga and breathing exercise, which is very important. Breathing exercise helps you to expand your lungs, so keep on doing breathing exercise. Even if you are not sick, I would advise everybody to do regular yoga and breathing exercise, whatever exercise comes in the yoga. Even other exercises are very useful. Don't just sit 24 hours in the bed. Keep on walking inside your room, so that your blood circulation improves also. So this is what I did. I had a fever for 16 days, almost persistent, but after taking medications, it was okay. I had to fight and I fought it, and now after 16 days of these symptoms, I became okay clinically. In between I had lots of ups and downs, but with the support of my family and support of my doctor, I became okay. And I wish that everybody should do well. Everybody should seek help of a doctor whenever there is a need. And please, please, please don't be panic. Don't be panic. Be strong, be positive, be optimistic. You have to fight. Use social distancing, use mask, wash your hands every 2 hours, and try to avoid public contact unless and until you need it. Well, I wish everybody all the best. Thank you, Dr. Bridge and Dr. Rajesh Paiteli. I appreciate your help, and God bless you and God bless everybody.